Hey everybody, I'm David Rice. I'm your chief editor here at DentistryIQ with one of my favorite people in dentistry.
Hey, I'm Deana Zost, if you didn't already know.
And Deana, welcome. We are here for Gloves Off. We've got a big topic here today. We're kind of kicking off a mini series and we're going to get right into it and talk about, I'm going to say, maybe the single most important thing we've got going on: lack of workforce.
Lack of workforce.
How do we combat this thing?
It is unbelievable. So I'm just going to preface this by saying this is probably going to be a Deana Zost you're not used to seeing because the gloves are off now. So I'll probably step on some of your toes, but I'll do it with all love in my heart because this is a really big topic. I don't think it's going away. And I'm in hundreds of offices a year talking to dentists, talking to teams about their lack of team members, lack of employment, lack of people just even showing up for an interview. Number one, I'm going to say this: in Texas, which is where I'm based out of in Fort Worth, in Texas, if somebody doesn't show up for an interview, you can report them to the Texas Workforce Commission. They compile a list. You can cross-reference if you got the time. I don't know. Check with your state and see if you can do it. I have sort of a twofold part to that. Is I have empathy for people because there are people who are very fearful. And, if you're fearful of being in a pandemic, if you're fearful of COVID, we all have valid reasons for our own feelings, but healthcare is probably not a place you want to be in if you're that scared. So maybe a reason they're not showing up. And it could just be that they like getting paid without working. Yeah, that happens. I'm saying I have no filter today. Here's what I'm finding out, and we're going to talk more about training in just a little while. But here's what I know. I go in, and the first person I see in the front is someone working in the front office. This is my tribe. These are my people. We're tired. And that's just the first team member I see. Yeah. Then I go in and I'm meeting the assistant and the hygienist and the doctor, and it's usually a core group. Now, I will say this: there are offices thriving that have had their same team members for years. I'm very fortunate. My daughter, Hannah, works for Nikki Green here in Fort Worth. And I'm telling you, people just don't come and go out of this office. That's not saying anything against you who are listening, because we're all in different areas. We all got different things going on. So I have empathy. But I'm also, we got to get back to work. Dentistry's still there. So going into these offices again, the first person I'm seeing, who's your captain of first impressions, and I hate to use such a cheesy term, but it's true: exhausted. And I see it more times than not. Or they're taking a breath and they're like, "Hey, how are you?" And they're trying. People say fake it till you make it. I always say fake it till you become it, because it'll happen. But I'm meeting you guys. You're tired. You still want to take the best care of your patients. And it's hard. It's hard when you have sort of a skeleton staff and your staff is getting sick and they're having to be home. They have family members who are home. So number one, we all need to love on each other. We are together in a practice far more than we're probably together with our own family. So we got to love each other, have empathy for each other, have understanding. There's going to be times where I snap at you, Dr. Rice, because you're just getting on my nerves and I'm tired. There's going to be times where you're like, "Deana Zost, she just talks too much. Get her out of here." But we don't mean it, but you might. So what do we do? What do we do? And I always say, long story longer in my case, it's real simple. I'm very passionate about how we take care of our patients, how that vibe is in our practice. There's value in that vibe. But how do we keep the business going and growing? Because guess what? You don't have to just be in survival mode. You can still be in. Did you know that?
Heck yes. So what do we do? Are there digital solutions?
Yes, that's what I'm getting to. You know me, long story longer. Software. I'm super passionate about software. If you don't already know, I'm with Patterson Dental. I am a Revolve specialist down here in Texas. And what do? I'm over 20 plus some softwares that can digitize your workflows. I'm not trying to replace anybody, but I am offering a solution. So when I come in, or you have somebody else from Patterson come in talking about software, I want you to think about what your software is doing. And I don't want you to think about your comfort level with your software. That's bunk. We got to get over that. Because there's, oh, I love this because I've used it for so long. Guess what? That's not a good enough excuse for me. And I'm going to ask some probing questions. Your software needs to be easy to use. And if you're like, well, it's not easy, is it because you don't like it? Is it because you're used to another software and you need some more training? Got to get some training. We need to have data. It needs to be simple to use, and you need to allow it to do what it can do. So there's all kinds of softwares out there to handle things like your revenue cycle management, your patient communication, your marketing. There's all kinds of softwares to check eligibility for insurance. I don't know if you know this, but at Patterson with EagleSoft and now with Fuse, we have real-time eligibility in the software. You press a button, literally press a button, it pings the insurance company, and within seconds, you get back about 4 pages of a full breakdown that auto-fills into your software. I just heard a bunch of people pass out and gasp. Hold on. I remember back in the day when I first got moved to the front office, really bad dental assistant, story for another day. We were calling. We were actually writing out our claims in triplicate, the whole claim. To be able to push a button and not have to sit on hold, 4 pages of full breakdown, that's huge. So for my insurance coordinators out there, let us take about 80% of what you're doing and let's make it digital. And then let's use your time with patient care or maybe presenting treatment or filling in. Let's kind of fill in for each other. We've all got to be able to get up and get in other people's seats and help out.
I love that. So the moral of this story is we need to excel at the things that our software can't do for us. We've got to learn the skills, pull in the right resources. Right software helps, right team to train helps. And just,
you know what I love about Patterson?
Work.
I got to say this. I don't mean to talk over you. I keep saying 5 years. I don't know if you do New Year's resolutions. I'm always like, I'm going to learn not to talk over people. I just get so excited about what I have to say, but I'm a work in progress. We have technology advisors at Patterson. They are Patterson employees trained to make your team successful. There's no, nothing else they're there for other than your success. Your training, making sure your numbers, they do these more practice analysis. There's so much they can do. Pull in the resources you have. And it's to call your Patterson person, it's free, give them a call, see what resources we have, but look at digitizing the workflow. Patient communication. Right now I pull up my phone. My physician's already texted me to confirm an appointment. That's easy. Come on, let that work. I hear a lot, oh, the patient wants to hear my voice. Have you polled them? Have you really asked them? Or you just don't want to give up that piece? I promise you'll love giving up that piece and letting the software do it. But look at software. It's not like, oh my gosh, we've got to make this big change and learn something new. Guess what? You're in dentistry. You learn something new every day.
Yeah.
Stop. I talked to a doctor a few weeks ago, and he had CEREC, and he had just bought an iCAD. He was doing all this stuff and placing implants, and he was talking about software. He's like, I don't know. I don't know. And I looked at him and I said, you've got to be kidding me. And he looked back and I said, listen, and I always say, when a Southern woman says, I'm saying it with all the love in my heart, we are. We got to call you out on your stuff. You know what that means. Yes. I looked at him and I said, look at this technology you have learned, and you are relearning as there are software updates and enhancements. Don't tell me you can't learn software. Stop it.
Totally agree. Friends, I got to tell you, so wrapping it up, W. Edwards Deming. If you've never looked him up, he's one of the world's greatest economists. 94% of our success is in our system. Build your digital systems. We have a lack of workforce issue in dentistry. That's not to say that the 6% of you and I doesn't matter, but we have to start diving deep into that 94% and bringing as much of our software into the play to eliminate this problem that we have. Deana, thanks for hanging out with us today.
Thanks. I appreciate y'all.